half kneeling, hip extension, static stretch, and pails and rails. We use this exercise in order to connect and open up space in the front of the hip to allow for greater hip extension. It's important to take your time in the initial setup so that you can find the tissues that we want to train. It's very easy to compensate elsewhere in the body, either going forward through the ankle at the front or extending through the low back. So do be aware of that. We will give the command of chest down, pelvis up in order to lock in that abdomen to give a better chance of sensation where we want it. Half kneeling base position, 90 degrees, foot under knee, knee under hip. Rib cage down, pelvis up, not extended through the low back. Once we've connected with this tissue on stretch here, can talk about whether you need the toe up or down. If you are limited by space in the toe, just pop it down. Once you find stretch here, you would hang out for 2 minutes, breathing slowly in, slowly out. Once you've completed your 2-minute stretch, we would then move into a series of pails and rails at varying intensities depending on your program. Your pails movement in this position to allow for loading of this stretched tissue, to take a breath, pack air down into the abdomen, and imagine that you were trying to drag this knee forward, almost to make the shape of the front knee. Once you find that you're loading these stretched tissues, you can then start to think about pulling the foot and the knee together. Your rails movement, or your rails contraction, will be then to use the regressive tissue. So we loaded this side, then we need to work all the tissues on this side. So what you're going to do is we'll take another breath and start to squeeze the bum as hard as you can. And what that will do is will push you into more extension. Okay? The hip drives forward into this new space. We don't want that to come from the low back or from the knee, just from activation of the regressive tissue. Once you have found the glute, you can then think about pushing your foot and your knee apart.